Hi, I'm Kristopher Ware, Orthopedic Surgeon and Sports Medicine Specialist at Orthopedic Associates of Hartford. This is an unusual time. Fortunately, we still see people getting out and being active. There's been an increase in the number of hikers and runners and cyclists, and specifically out on the trails we've seen an explosion in the number of mountain bikers. As with any sports activity, injuries do occur, and so what we'd like to offer you is a few simple suggestions on things that may be helpful to reduce your risk of injury. Speaking specifically to the runners, most of the running injuries, aside from ankle injuries, are overuse injuries. So we see problems like patellofemoral pain syndrome, iliotibial band syndrome, medial tibial syndrome, stress fractures, and that's really just to name a few of the overuse injuries we see in runners. In order to reduce your risk of injury, especially for the new runner, you need to consider your volume and intensity. I think it's important to have goals in mind. Doing a couch to marathon a type of approach over the matter of over a few weeks is probably not the best approach. You need to consider how far you're going to run, what type of terrain you're going to run on, and the old rule was not to progress more than 10% in your distance per week. I think for most runners that's still a good rule of thumb. The other things that are important is having the right footwear. Using your old shoes that you found in the closet is probably not the best way to start off your running career. If you start to experience pain, the hardest thing for a runner to stomach is the need to take relative rest, but really it's usually the most important thing. Ice is important as well, and cross-training. So during that period of relative rest, you can try other activities like cycling and swimming in order to change your activity. If you have an injury where you're not able to get back to running or the pain persists even during daily activities, that's when you need to seek attention. We'd be happy to take a look at you or give you some advice. For the mountain bikers, many mountain bike injuries are traumatic injuries. We see significant traumatic injuries to the upper extremity with clavicle fractures and acromioclavicular joint separations. There's also overuse injuries in mountain bikers, patellar tendon problems, which includes patellar tendonitis and patellar tendinopathy, Achilles tendonitis, iliotibial band syndrome, among others. We also see a lot of patients with back injuries related to mountain biking. For mountain bikers, it's very important that you consider the terrain that you're riding on and your preparation for it. So if you are getting fatigued and dehydrated, you may not be making the best choices, especially if you're a downhill rider or if you're riding on technical terrain. Other things to consider are the equipment you have. Certainly you need to have your helmet. In certain cases, especially downhill riders, it may be important to have elbow guards as well as shin guards and knee pads to reduce your risk of injury. If you have an injury where there's a significant deformity, significant bruising, severe pain, that's when you should seek medical attention and have that evaluated to make sure that you don't have one of a fracture or dislocation. For the overuse injuries, similar to runners, taking a break from the activity, using ice, relative rest is probably the most important, and for some patients, anti-inflammatories can be helpful. If you don't see improvement with that, then that's when we'd be happy to hear from you and hopefully be able to steer you in the right direction. We hope that you stay safe during this COVID-19 pandemic, and we hope that you can continue to get out there, enjoying the outdoors, and avoid injury.